Sarah had rhabdomyosarcoma, which is a cancer of cells that should be muscle cells. It's quite rare. In the United States, there are less than 500 children a year diagnosed with rhabdomyosarcoma. The vast majority of people do not survive.
And that's where Dr. Weigel and Dr. Yee and others are so important in this, because they are physician scientists. And you need people who are fluent in basic science and fluent in clinical care. And going back and forth is really the superpower of academic medicine.
You get a real multi-specialty approach to sarcomas across the ages here at the University of Minnesota. And that makes us unique in the pediatric oncology space. There are very few centers like us in the United States.
Just being old is the #1 risk factor for most chronic diseases. So there's something about the biology of aging that's really setting us up to be vulnerable to all these diseases.
We are not talking about immortality at all. What we are talking about is having a longer time with not being pushed to the outsides of your life. And if we can use science as a tool to get to some of the origins of the malfunctioning tissues, that would be an enormous decrease in human suffering.
And so that's led to kind of a really new paradigm in the field of aging. And that is, could we therapeutically target the biology of aging? So all of these things that change as we get older, develop a drug to target those and not your high blood pressure or your diabetes. The rapid aging of our population worldwide is a huge challenge. It's just going to have a huge impact on every aspect of our life. It's satisfying to go after something that big and challenging.